Welcome, medical students, to today's lecture on gastroenterology. Today, we will be diving into the complex world of chronic gastritis and its associated mechanisms, clinical implications, and therapeutic interventions. Chronic gastritis is a condition characterized by long-term inflammation of the stomach lining, which can lead to various gastrointestinal symptoms and potentially progress to more severe conditions, such as gastric cancer. Understanding the underlying mechanisms of chronic gastritis and its associated factors is crucial for accurate diagnosis and effective management. Now, let's begin our exploration of the fascinating world of chronic gastritis. In summary, autoimmune gastritis is a type of chronic gastritis caused by immune system damage to gastric cells. It is commonly found alongside other autoimmune diseases and has shared genetic and immunological factors. Recognizing and treating autoimmune gastritis can improve symptoms and prevent more severe gastrointestinal problems. Cytokines play a vital role in chronic gastritis by promoting inflammation. Different pro-inflammatory cytokines, like IL-1, TNF-alpha, and IFN-gamma, are elevated in the gastric mucosa of affected individuals. These findings provide potential targets for therapeutic interventions in chronic gastritis. The gut microbiota is important for gastrointestinal health. Changes in gut bacteria have been linked to chronic gastritis. This section discusses the role of the gut microbiota in chronic gastritis and potential treatments, such as probiotics and fecal microbiota transplantation. Epigenetic modifications, such as DNA methylation and histone modifications, play a role in chronic gastritis and the development of gastric cancer. Studying these changes may help identify new treatments to reverse abnormal gene expression patterns and restore normal cellular function. In this section, we will explore the role of genetic variations in inflammation and their impact on chronic gastritis. We will focus on specific genetic variations in pro-inflammatory cytokines and how they affect disease susceptibility and progression. Understanding these genetic factors can help in identifying at-risk individuals and developing personalized treatment strategies. While Helicobacter pylori is the most well-known bacterial pathogen associated with chronic gastritis, there are other less common bacterial infections that can lead to similar gastric inflammation. This topic aims to explore the less common bacterial pathogens that can lead to chronic gastritis, their clinical presentation, diagnosis, and management. Examples include non-Helicobacter pylori helicobacters, such as Helicobacter heilmannii and Helicobacter felis, as well as other bacterial species, such as Mycobacterium tuberculosis. Recognizing and appropriately managing chronic gastritis caused by these less common pathogens is important to ensure accurate diagnosis and targeted therapeutic interventions. This topic will delve into the clinical characteristics, diagnostic methods, and treatment options for these unique cases. In this section on chronic gastritis in pediatric patients, we will discuss the challenges of diagnosing and managing this condition in children. We will explore the appropriate diagnostic tests and therapeutic options, with a focus on tailoring these approaches for the unique needs of pediatric patients. Additionally, we will delve into the specific causes of chronic gastritis in children and how understanding these etiologies can inform personalized treatment plans. Proper management of chronic gastritis in children is vital for symptom relief, complication prevention, and long-term well-being. Although chronic gastritis is typically associated with lymphocytic infiltration and/or neutrophilic inflammation, there are rare forms of gastritis that present with unique histopathological findings. This topic aims to investigate less frequently encountered forms of chronic gastritis, including eosinophilic gastritis and lymphocytic gastritis. Eosinophilic gastritis is characterized by a significant increase in eosinophils within the gastric mucosa, while lymphocytic gastritis is characterized by an abundance of lymphocytes within the gastric epithelium. Understanding the etiology, pathology, and appropriate management strategies for these rare forms of chronic gastritis is essential for accurate diagnosis and optimal patient care. Targeted treatment options, such as corticosteroids or elimination diets, may be warranted in certain cases. Proton pump inhibitors, PPIs, effectively manage chronic gastritis by reducing gastric acid secretion, providing symptom relief, and promoting healing. However, long-term use may lead to nutrient deficiencies and increased infection risk. Understanding appropriate usage and potential risks is vital for optimizing patient outcomes. Chronic gastritis has been shown to have significant effects on gastric acid secretion and motility, which can have diverse clinical implications. This topic aims to explore how chronic gastritis affects gastric acid secretion and motility, including the potential consequences and their clinical implications. Chronic gastritis can lead to hypo or hyperchlorhydria, resulting in altered gastric pH and impaired digestion. Furthermore, changes in gastric motility patterns, such as delayed gastric emptying or impaired antral contractility, may contribute to the symptoms of chronic gastritis. Understanding these effects and their impact on patient symptoms and overall gastrointestinal function is crucial for tailored management approaches. Chronic use of NSAIDs increases the risk of developing gastritis by disrupting the protective factors in the gastric mucosa. Understanding the underlying mechanisms can guide preventive strategies and educate patients about the risks of NSAID use in managing chronic gastritis. In this section, we will discuss the potential use of stem cell transplantation in treating chronic gastritis. Stem cells have the ability to regenerate damaged tissues, and early studies show promising results in restoring gastric mucosa and improving function. The mechanisms, challenges, and future applications of stem cell therapy in chronic gastritis will also be explored. In summary, chronic gastritis is a multifaceted condition with various causes, mechanisms, and symptoms. Understanding these aspects is crucial for accurate diagnosis and management. Thank you for your attention and keep exploring gastroenterology.